Evening, y'all. Welcome to the introductory course for tutorial for the Dolphin Neurostim and for scar tissue and for the vagus nerve stimulation. My name is Joe Durant. I'm one of the senior instructors for the Center for Pain and Stress Research and Acumed, and also one of the researchers for some of the studies. So tonight we're going to be going over the features of the Dolphin Neurostim and how you use it. So if you have a Dolphin Neurostim, depends on what you have. You may have a case that has two of them in there, or you may have one of these vagus nerve stimulation kits. But if you will, pull out your Dolphin Neurostim. If you have an older model, it may look like this. It may have a white tip instead of a blue tip, but the blue tip is the most recent model. So I'm going to go over each of the features of this with you guys so you can see how we use it, and make sure you guys are using it properly, because there are a few little pitfalls here. So starting on the front of the unit, we have a button right here. When the unit is on, if you depress this button, it makes the unit execute a treatment. But as soon as you release this button, it stops treating. Next, we have a roller switch. This turns the unit on. And this is also your intensity level. So the more you roll this, the more intense it is, okay? And then beyond that, we have what's called a constant treat button. So when the unit is on, it doesn't do anything when the unit is off. When the unit is on, if you push it in, it puts the unit in a mode so that it will treat constantly without holding the button down for about 12 to 14 minutes. And after which it'll beep to let you know that it's time to either push the button again or do something else in your treatment. If you flip to the opposite side of the unit, you're going to see a metal plate. When you are executing treatments, unless you have an electrode on this plate, which we'll get into in a little bit, you have to have your thumb on this plate to execute a treatment. If you do not have your thumb on this plate, you're basically just doing acupressure. Next, there's a little slider switch that says wet, dry, normal skin. So this affects the sensitivity of the ohm meter of the unit. So this helps you find treatment points, which are acupuncture points or myofascial trigger points. So depending on how moist your patient's skin is, or your skin is, you're going to make adjustments with this. Above that, you're going to see a little button that has a plus, has a minus, a plus, and a plus minus symbol. And this allows you to choose the polarity of the equipment. So if you look in the books that come with the equipment, each of the protocols will have either a plus or a minus next to every one of the steps. And sometimes you'll see this biphasic channel. And just so you guys know, like, I'm going to run through all this, and at the end we're going to do a question and answer section. So keep your questions in mind, write them down, and hold them to the end. So we're going to do about an hour of instruction, and we're going to do about 30 minutes of question and answer, okay? All right. And the next thing you have is a battery compartment in here, right here at the very end. So to change the batteries on these units, you do not have to take any screws out. If you turn the unit on and you get a green light like this, that means your battery is good. But if you turn your unit on and you don't get a green battery, that means you need to change the battery. So I'm going to show you how to do that right now. So the battery compartment is right here. You need something like a coin, or I like to use a pocket knife, but it doesn't really matter. So if you simply flip this compartment open, you'll see there's a 9-volt battery inside. We like to use Duracell batteries, Energizer batteries, Panasonic batteries work okay. I'm going to give you like a quick word on battery selection here. When we design these units, we design them so that it is a set size compartment. So you don't have to worry about those little wires that come out that connect to a pad, because those tend to break quite a bit. So we designed it to hold a 9-volt battery. The problem is that once you get outside of major battery manufacturers, the size of 9-volt batteries actually changes. So AA batteries, AAA batteries, C batteries, D batteries, all those batteries are exactly the same size. But for whatever reason, 9-volt batteries can be a little bit shorter or a little bit longer. And that's problematic because if you put one in and it's too short, it's going to rattle back and forth and get intermittent contacts, and it's going to affect your treatments. If you have a battery that's too long and you force it in, you're actually going to push the circuit board around on there. So you want to stick with Duracell batteries. That's what I recommend. But Panasonic batteries can work okay as well. So I'm going to put a new battery in here. This one's a Panasonic that I happen to have sitting here. And when you go to put your battery compartment cover on, it's going to feel like it's going to break. It's a really tight fit, so you can see and hear, but it doesn't break. Once you turn the unit on, you're going to check, and if you get a green light, then you're good to go. So with the unit on, I'm going to demonstrate what it looks like when you do a treatment. You're going to put your thumb on this plate right here, and you're going to push this button down, and you're going to see the green light beep a bit. But if I put it on the concentrate button, you'll notice that it's also beeping, but I'm not touching any of the buttons on it. Okay. All right. So that's kind of all the little things about how to turn the unit on and off. The tip of the unit is spring loaded, so it significantly cuts the chances you're going to put a hole in anybody's skin. You still need to be really careful when you're working with older people or diabetics who have fragile skin. That's almost a necessity with those guys. And when you go to clean this, you can clean it with an alcohol wipe. Don't get liquid up in the tip. It'll affect the conductivity of the tip, and the entire treatment revolves around your ability to disperse electricity from the circuit board in here through this tip into your patient. All right, so holding these units, there is really only one way these units are designed to be held. So you want to put it in your hand like you were holding a pen or a pencil. So you want this little curve to rest right there in the crook of your thumb. You want to place your thumb on the metal plate, and you want to put your middle finger right over this button. So that when you turn the unit on and you go to do a treatment, you can hold this button down with your middle finger. Now, the other part of this is that this is direct current electricity. So this has to go in the patient and come out of the patient and get back into this equipment. So the way you do that is by having skin-to-skin contact with your patient. So you have to take either the hand that you're treating with, like your finger or the palm of your hand, or your other hand, and touch your patient's skin. It doesn't work if you touch their shirt or their pants. So if I were, say, doing a treatment on a patient's face, I would have to touch the patient's face either with my hand, either one of my hands, have my thumb on this metal plate, and touch it down all at the same time. And I'll let you hear. Do you hear that? You can hear this high pitch. As soon as I take my hand off, you'll hear a higher pitch. So when you go to treat yourself, you don't have to touch yourself anywhere else because you're already touching the equipment. Okay. So when you're treating yourself, you just hold this and touch it down on your treatment points. But when you're treating someone else, you have to have skin-to-skin contact. This tip is designed so that it can work through the weave of clothing, but you can't just place it down on the clothing and expect it to work. So you typically have to set it down and work it around until you get the tip of it actually through the weave of the clothing. So you have to work it around in little tiny circles. And if you're careful, it will actually work through the weave of blue jeans, but it's not easy. So it has a really hard time getting through the weave of things like tight weave running pants, because those are almost waterproof. All right, so that's how to turn this on. That's how to push the button. That's how to change your battery. That's how to adjust the polarity, how to adjust the sensitivity of the ohm meter, and your little, and when you change, if you go to change the intensity of the device, you can roll, there's a little roller switch here. So when you're treating the patient, if they tell you it's too much, you can turn it down a bit for them while you're treating them. All right. So the next thing we're going to do is we're going to talk about how to use these devices to treat scars. And so you're going to need two devices. So I've got two devices here. And we're going to talk for a minute about what you need to do to release a scar. So scars are basically depolarized tissue, so they do not conduct electricity well. But if you can restore the capacitance of the tissue to conduct electricity, then you can actually change the density of the tissue. And what you should expect is about a 20% reduction with a proper treatment, about a 20% reduction in the overall density of the scar tissue after the treatment. And that's an immediate response, and it's something that's permanent. So we've tested this with diagnostic ultrasound. The measure is called the cicatrix gray mean density. That's how you measure it. So anyway, in terms of treating scar tissue, this works better. I'm a massage therapist by trade. This device works better than your hands. It works better than gua sha tools. It works better than cupping or these electronic cupping devices. It works better than TENS units, and it even works better than dry needling techniques, because what you're trying to do there is just infiltrate the scar. And it actually, in a lot of cases, actually outperforms neural therapy injection, which is designed to repolarize the tissue with procaine. So that being said, and the reason for that is because you can actually flood the entire scar with electrons with this, which allows you to repolarize the tissue. But it does require two separate sources of electricity. So you really can't do this with one unit. You have to have two. So you have to be able to push electrons from one side and pull to the other. And if you can't do that, it makes it very, very difficult. All right, so I'm going to draw a scar here for you guys. So we're going to pretend that this is a scar, like a linear scar. And I'm going to show you guys how to treat it. So you're going to take one of these units and you're going to look at the polarity and you're going to set it on the negative setting. You're going to take the other unit and you're going to slide it over to the biphasic setting. That's the one that says plus and minus. Again, negative on one, biphasic on the other. You don't have to have skin contact with both hands, but the more skin contact you have with your patient, the better the treatment's going to be. So you can touch down with one hand or both hands to initiate skin contact to allow the electrons to go back through your hands into these devices. All right. So if this is a scar, you want to take these devices and you want to go on either side of the scar. And I'm actually going to kind of tape this to my shirt here so I can show you guys initially what we're going to do. All right. So here's your scar. On one side, you're going to have the negative polarity. On the other side, you're going to have the biphasic channel. And you're going to go every quarter of an inch or so. So you're going to work along the outside border of the scar. You're going to set the units down. You're going to count out 10 beeps. Then you're going to move down about a quarter of an inch. And then you're going to do the same thing. 10 beeps, 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 all the way to the end. Now, a lot of people ask if they should hear a tone in the change of the unit. You're not trying to find acupuncture points here. You're basically trying to repolarize tissue that's depolarized. So don't expect to hear a lot of change in the tone initially. When you get to the end of the scar, so you can start at the top and go to the bottom, or start at the bottom and go to the top, doesn't matter. When you get to the end of the scar, you can do one of two things. You can either slide the polarity switches and go to biphasic on one side and negative on the other, or you can simply switch the devices in your hands like this. Then you start at the bottom of the scar, and you go in the areas counting 10 beeps. You go between the areas that you haven't treated already. Again, every quarter of an inch, counting out 10 beeps each time. So that's one pass down, one pass up. You're going to change the units again, and you're going to go back down the scar again, 10 beeps each time. So you're going to make 3 passes, down, up, and down, or up, down, up, however you want to do it. After you do that, you're going to take the Dolphin units and go at either end of the scar and hold the units there, which is called plugging the ends of the scar. Now, personally, you can stop there, but personally, I prefer to go through the entire scar. So I'm going to work every 1/4 of an inch through the scar. Again, 10 beeps again, till I've gone all the way to the end of the scar. And I'm going to do that 2 more times. So I'm going to make 3 passes actually on the scar tissue itself, just like I would up and down the sides of the scar. So at this point, you've played ping pong with electrons back and forth through the scar, all the way down, all the way back up, and then all the way back down again. And then since you've repolarized this tissue, now you're taking the devices and actually putting them on the scar tissue and driving current through that way. So in doing this, what you're trying to do is flood the tissue as much as you can with electrons. And once you repolarize that tissue, it becomes much more pliable. So that's going to take pressure off of nerves that are entrapped in there. It's going to stop the scar from affecting the autonomic nervous system. So one of the things that scars do is, even though they don't conduct electricity well, they act a little more like a battery or a capacitor, and they will hold an excessive charge, and they'll stimulate the local sympathetic nerve fibers. Not a lot, but a little bit. 24 hours a day, 7 days a week, 365 days a year. So over time, it actually has the effect of winding up your sympathetic nervous system, which is your fight or flight response. So if you have a patient that's in pain or has been traumatized or is trying to heal, and you go and you have surgical scars on the patient, and they don't have to be painful, or scars from injuries that don't have to be painful, they electrically affect the person's sympathetic nervous system. So in essence, what they become is a factor that that gets in the way of your ability to provide some kind of neuromodulation to bring down their overall level of sympathetic arousal. If that scar is wound up and it's firing off and setting off the sympathetic nervous system, it's really difficult to make other things happen for the patient. And this will affect things like anxiety. It will affect things like patients' remembrance of traumas. A lot of times when we're treating scars, if there's a traumatic event involved, it could be a C-section. It could be an injury from being in a fight. It could be from some kind of horrific accident. You will see emotional releases in your patients. So don't be surprised if your patients get teary-eyed and sometimes cry when you treat these scars. It doesn't happen all the time, but it does happen. And it will certainly unwind a lot of anxiety with your patients. So that's the basis of treating a scar. Now, what if the scar is not a linear scar? Suppose it's a circular scar. Suppose it's something like this, that's more like a burn scar. So it doesn't really matter. You're going to use the same strategy. So let me tape this to myself again so you guys can see it. You're going to be working around the scar with your devices. Start on either side and just work every 1/4 of an inch all the way around. And you're going to make 3 circles around the scar. And then you're just going to work through the belly of the scar. Obviously, the surface area inside the scar is a lot bigger, so this is going to take a lot longer. So in practice, what it looks like is this. I've got 2 devices, one on the negative setting, one on the biphasic settings. I'm going to turn them on. I'm going to make sure I got green light, so I know I've got plenty of battery power. I'm going to put my thumbs on the, it's not really a grounding plate, it would be the anode plate. And I'm going to go on either side of the scar, making sure I have skin-to-skin contact with the patient. Now I'm going to hold the buttons down. So I'm going to go for about a 10 count. I'm going to work around. So every 10 beeps, I'm going to work another place along the border of the scar. And as I work around the scar, I will eventually switch my hands and continue to go around the scar, each time making sure I hold the buttons down so that I initiate a treatment. So after 3 rounds, I'm going to go through the belly of the scar. Typically, it takes about 5 treatments, 3 to 5 treatments to properly release a scar. You're going to spend anywhere from, depending on the size of the scar, 20 minutes to an hour or so working on a scar. And really that is dependent entirely on the size of the scar. There are advanced techniques you can use when releasing a scar. There are ways to put electrodes on these devices and run pads behind the patient so you can work on deep abdominal scarring. We actually do a whole class on scars. We do a whole live class on scars. I think we've got going coming up in about 2 weeks. That's going to be, or maybe 3 or 4 weeks. I think it's going to be in DeLand, Florida. So you can get online and you can check out our workshop schedule. And I think it's a combined course. I think it's going to be an auricular acupuncture course, like an ear acupuncture course, combined with scars. All right, so that's the basics of scar release. And so if you have any questions about that, write them down, hold them to the end. And I'm going to switch over at this point, and we're going to talk about vagus nerve stimulation. So vagus nerve stimulation is a complicated topic, but I'm going to try to make it as simple as possible and just get across the basic points. Vagus nerve stimulation has been around for a long time. There are chants in yoga that affect your vagus nerve. You can affect vagus nerve by dunking your head in cold water, by taking ice baths, by doing Christian breath prayers, by gargling. There are a lot of different ways you can affect the vagus nerve. But generally, you affect the vagus nerve in very small ways. So it's really difficult to get big swings in the vagus nerve. So the vagus nerve is sort of the calming nerve of the body. It's like the information superhighway between the gut and your brain. I think about 80% more signals go from the gut to the brain than from the, or about 80% of the signals go from the gut to the brain than go from the brain to the gut. So it passes on a lot of information and tells your brain when to calm down or speed up, and really is the modulator between sympathetic and parasympathetic response. So your sympathetic response is your fight or flight response, and that is the response that gets you ready to fight or flee when something happens. And short term, it's a very useful thing. Long term, if you stay in a sympathetically upregulated state, it impedes your ability to heal. It impedes your ability to relax. It impedes your ability to sleep, and it actually affects your immune system, because when your system is stressed, it raises your cortisol, and your cortisol actually suppresses your immune system because it goes after inflammatory stuff. So when you're awake during the day, your sympathetic nervous system is a little more active. When you sleep at night, the parasympathetic nervous system takes over. That's more of your rest and digest. That's when healing occurs. You do have some parasympathetic activity all throughout the day, but the bulk of it happens when you sleep in terms of recovery. So to be able to properly modulate that, you'll find that there are some people who are elite athletes who put themselves into overtraining syndrome, and when they do that, they can't recover from their injuries. So same thing goes with people who have severe diseases like MS, COVID. These devices actually have a medical indication for acute respiratory distress with COVID and for long haul COVID. And they have that through Health Canada, which is the FDA in Canada. They have that because of the ability to trigger the body to heal. So typically when you research vagus nerve stimulation, you'll see devices that have clips that go from one ear to the other. And the vagus nerve starts sort of right in this area. This is about as close as you're going to get to it. But if you're running electricity from one ear to the other, you're basically kind of doing transcranial microcurrent. We actually prefer to actually follow the vagus nerve and sometimes incorporate acupuncture points with our treatments. So we're going to go over how to apply a vagus nerve stimulation here. And after that, I'm going to show you how to locate some acupuncture points with this and use it to treat acupuncture points. So if you have a vagus nerve stimulation kit, you're going to open it up and you're going to find a couple of bags in there. And in the bags, you are going to find some ear clips. There should be 3 ear clips. They might be black, they might be red. You're going to have a black cable that has a little cup on the end of it. You're going to have a bag of electrode pads. In that bag, there's going to be a white cable. The white cable comes in 2 variations. So I've put 2 of them in here so you can see the 2 different variations. One variation has 2 male ends on it that look like this. The other looks like it has a male end and a female end, but if you look carefully, it's actually a shrouded male cable. So whether you have this one or this one, they're both male and male ended cables. So don't get concerned if you don't see a little prong sticking out. If you look inside, there is one there. You're going to have some 2x4 electrode pads. And you're also going to have some specially cut electrode pads that are designed to fit on this oval surface of your Dolphin Neurostim. So the first thing we want to do is pull out this black cable. And if you look inside the cable, you're going to see a little bit of shininess in there. So there's a metal plate in there. That metal plate has got to touch the tip of this unit. If it does not touch the tip of this unit, you're not going to be able to conduct electricity through this to help your patient out, okay? So we're going to take this, we're going to press it all the way on. And what I like to do is I like to turn the unit on and put a finger on this metal plate and then touch the metal prong. You can hear the pitch go up and you can see the light go out. So that indicates to me that we're completing the circuit. All right. The next thing you want to do is take one of your black or white ear clips, depending on what you have. Put it on the male end. These are designed to fit on your earlobe. You may have to moisten them a little bit if your earlobe or your patient's earlobe is dry. I like to use a little bit of EEG paste. So there's a paste that is called 1020 paste that looks like this. If you buy a tub of this, it will last you for years because it only takes a tiny, tiny amount of it. But I'll put a little bit of that on the end of the clip sometimes if my patients have a dry ear. The other thing you want to do, so you've got your connection on the tip to the ear clip. You're going to pull out one of these oval electrodes. You're going to make sure that this metal plate is clean. I like to use alcohol wipes. And you're going to place it on here. You're going to connect your white cable to it. Doesn't matter if it's shrouded. And then at the other end of it, you are going to take one of these 2x4 pads and connect it up. So at this point, we have both cables connected to our device, one by a cup, one by an electrode. One of them goes to an ear clip that is coming off of the tip of the unit. The other is coming off of the metal plate of the unit and goes to a 2x4 electrode. So you're going to take the electrode that is the ear clip and you're going to put it on your left ear, okay? Don't mess with the right ear right now. We're going to keep it on the left ear. You're going to take your 2x4 pad, and there are 2 different approaches that we're going to use. So your approaches are either to place the device on your left wrist, right across the base of your wrist, and it covers 3 acupuncture points right there that we're going to go over in a little bit that are all parasympathetic calming acupuncture points. Or you're going to take the pad, and I recommend that you clean the surfaces with alcohol. If you clean the surfaces with alcohol, you can use it on yourself over and over again until there's no stickiness left in this pad. So the cleaner your skin is, the better this works. Obviously, if you're using on the same patient over and over, that's fine, but don't use the same electrode for different patients. So you're going to go 4 fingers below the belly button. You're going to lift your shirt up, and you're going to put it right there on your tummy. So once you've got that done, you're going to turn the device on, and if it's properly connected, you're going to hear a high pitch whine. Sometimes the light will go out. My ear's a little dry right now, so I'm going to put a little bit of paste on this so that I know I have a good connection. So now the light is out. I'm going to put the device on the negative setting because we're trying to bring things down. I'm going to turn it over, and I'm going to push this concentrate button. So the little tiny, not the big button, not the roller switch, but the tiny little button here at the top. I'm going to push that, and the unit's going to go silent. So you may feel some electrical thumping in your ear. If you feel that or your patient complains of that, turn the device down until it's subsensory. And at this point, you are going to, if it's a first treatment, you're going to do a first treatment for about 5 minutes, and then you're done. So every patient of mine, everybody I start with vagus neurostimulation, I have them come in the office, and we do 1 5-minute treatment. And I just want to make sure everything's going to be okay for the patient. I've never had any problems, but sometimes people get a little tired with this, so you just want to kind of gauge how it's going to be. So my instructions to the patient are to use this in the evenings, not in the mornings. Evenings is best because that's when your parasympathetic nervous system is starting to be more active than the sympathetic nervous system. So you're going to use this in the evening. You're going to use it for 5 minutes, and then you're done. If everything goes smoothly, the next day, you're going to add 5 minutes to that. So I have my patients add 5 minutes each day until they reach about 20 minutes. Sometimes I'll go as high as 30 minutes with the patient, depending on the condition. But once they hit that, I kind of use that as kind of the cutoff point so we don't overtreat the patients. Now, some patients require daily treatment. Some patients only require treatment once or twice a week. It really kind of depends on what's going on. If you have somebody who is in the midst of recovering from COVID, they're probably going to use this device daily, and they may end up using it more than 30 minutes at a time. If you have somebody who is recovering from mold toxicity, it's going to be an everyday thing. If you have somebody who has a severe autoimmune disease like MS, you're going to use this thing daily for a while until your symptoms start to come down. If you're someone who's using this as a recovery aid from workouts, you're typically going to use it once or twice a week once you kind of get into the swing of things. You don't want to overtreat yourself because your system has to come up after you bring it down. So you want to make sure you're never going to make it go so low that you're going to bottom your patient out, but you can make people actually feel a little bit fatigued if they use it too often, and you want them to have enough energy to do the things they need to do. So to recap, we've got a cup that goes on the end that goes to a clip that goes on the ear. We're going to use that. We're going to run that to the ear. Sometimes you need to put a little cream on it. A little salt water works. You also have an oval shaped electrode that's going to go on the back of this unit. It's going to go to a pad. Now, you can also put that pad on the wrist, right across the base of the wrist. And that puts you over 3 acupuncture points that we call the golden triangle that are calming points. You can also use this approach. Both of them work. When we did the testing, statistically, we found that the putting it over the wrist got us statistically more significant results than putting it under the belly button. However, that being said, you can split your time up. You can do half the time below the belly button and half the time on the wrist, because it does do two slightly different things. On the wrist, as you're treating these calming acupuncture points. Below the belly button, you're over something called the conceptual vessel, which is an acupuncture meridian. All right, so if you look in your COVID, your vagal up COVID book, the protocol may differ a little bit. It actually may have you do some, maybe use some positive polarity treatment. And so we have a whole forum online. So if you sign up for that through our website, you can get on there and ask questions about different things. You also have a quick setup card, vagal stem therapy setup card that comes with your stuff, so you can actually see how to do this. And we will keep you guys updated as we make changes to the VNS protocol, because we are doing more and more research all the time, and protocols change a little bit over time. So what you get tonight may be different in 6 months from now. All right, so I'm going to pull all these off. We're going to go over how to locate acupuncture points with this device. So acupuncture points, myofascial trigger points, and motor points, which are the most electrically active points in a muscle, all have one thing in common. What they have in common is that they are all highly electrically active, and they have lower electrical resistance at the skin than the rest of the skin around the area. So if you go to the hardware store and pick up an electrician's ohm meter, you can actually locate most of the acupuncture points. You just roll it around the body until you find areas that the dial dips higher or lower. It's very inefficient to have to look at a dial the entire time you're trying to find points. So what we've done is we've incorporated a tone into this device, and this device does have an ohm meter. So when you pull this across your skin, and I'm going to show you some points in a minute, there are some do's and there are some don'ts. Remember, you have to have, when you're finding points, you don't touch any of the buttons, okay? This is what we call search mode. So when the device is on, it's in search mode. Don't touch any of the buttons, but you have to have your thumb over the metal plate, and you have to have skin contact with your patient. It can be with the same hand you're treating with, or it can be with the opposite hand. And remember, it can't be on their clothing. It's got to be on their skin. So when you are searching for points, if you push too hard with this device, what's going to happen is the light's going to go out and you're going to get a high pitch, which indicates you found an area of high conductivity. Typically, that would mean that you found an acupuncture point, a motor point, or a trigger point. The problem is, if you push really, really hard with this device, you'll compress the skin. When you compress the skin, it becomes more conductive. So the key to this is to be consistent in how you pull this across the skin. Touch down lightly, use mild to moderate pressure, and go slowly. If you go quickly, you're going to have a very difficult time finding the points. So I'm going to pull this across my skin here, and I'm going to turn it and hold it the way I'm not supposed to hold it, but I'm going to touch the metal plate here and turn it so you guys can see the metal plate. So you can see the light and listen to the tone. As I pull this across the skin, so here I found an acupuncture point. This specific acupuncture point is called large intestine 4. It's known as Hoku. It's known as the great eliminator. It's influential for the anterior neck and face. It's good for tension headaches. It's probably the most widely used acupuncture point in the world. So anyway, moving right along, I'm going to teach you to use this to find 3 key acupuncture points on your wrist. So to do that, we need to locate a couple of landmarks. So I'm going to take this magic marker here for you guys so you guys can see. And if I bring my wrist forward like this, it creates a lot of different wrinkles down here and creases. Not really wrinkles, but creases. But if I bring my wrist back like this, there's really only one crease visible, and that's the crease that's right at the base of the palm of my hand. So I'm going to draw this for you guys so you can see it. You can see that it's not exactly straight. It kind of follows the outline of the palm of my hand. So we're going to call this our reference crease. Now, if you take a ballpoint pen, let's see if I have one here available. If you take a standard ballpoint pen, like this, and place it just below that reference crease, you'll notice that there is, and flex your hand a little bit, you'll notice there is another crease that is just below there. So that crease is about the distance of a width of a pen below there. So when you mark it, you'll have two marks like this. So we're actually going to call this crease the treatment crease. And on this crease, we're going to find two key acupuncture points. One is on the heart meridian and one is on the lung meridian. So starting on the thumb side, if you take your finger and palpate not on the reference crease, but on the treatment crease, you can actually find your heartbeat there. So the radial artery runs right past here. And the acupuncture point is very, very close to there. Now, if you were using acupuncture needles, it doesn't make a lot of sense to stick a needle through the radial artery because then you have leaking problems. So what we're going to do is we're going to go just towards the middle. So towards the pinky side of this line. And we're going to take our Dolphin Neurostim here. Let me get the magic marker off my fingers before I touch this device. And we're going to work towards the middle, pulling this gently. There's a little hollow right there, and when I get it, the light goes out and the pitch goes up. So once I'm on that point, I'm going to hold it down, and I'm going to count out about 30 beeps. So this point is on the lung meridian. It influences things like the emotion of grief. It influences your chest. It influences the lungs. It is a calming point. It really, really calms your system down. Now, on this very same line, once you're done treating that, there's another acupuncture point on the pinky side. So if you take a pen or a magic marker or whatever you have and pull your pinky away from the ring finger, if you draw a line straight down, so I can get this to draw for you guys. If you could draw a line straight down to that treatment crease, that's not really showing very well. So let me make this a little bit darker for you guys. Where it intersects, there's a hollow there. So there's a hollow right in here between the tendons. And that hollow is on the heart meridian. The heart influences things like your thinking. In acupuncture, your heart is considered to be the emperor. It controls everything. So the heart controls the mind. So your heart is passion, and passion always overrules logic. So if you're trying to calm your mind down, you want to treat heart points. So this is another one of our acupuncture points. So if you take your Dolphin Neurostim, work across this line, once you get in that crease, you're going to find that you get a really high pitch and the light's going to go out. This does take a bit of practice. So when I first started using these devices, I was able to find some acupuncture points the first day I tried it out. And I would say that practicing with it daily for, I don't know, 20 minutes or so, I was very comfortable finding points after about a week. So it does take a little bit of practice, but it's not hard practice. It's easy practice. You can actually go directly in and start treating patients with this or treating yourself. Even if you don't get directly on top of the acupuncture point, if you get even close, this device is enough to get a response for you. None of you guys are going to, for the most part, be acupuncturists with 20 years of experience. So we don't expect you to be able to nail these points right out of the gate. So there's enough overflow when you touch down on these areas to get the energy into the points so that you have an effect on the body. All right, the next point we're going to look for is a point on the pericardium meridian. It's called P6. So to find that, you're going to go not from the treatment crease, but from the reference crease above there. You're going to go 1, 2, 3 fingers, and then go between the tendons right here. So there are 2 tendons right there in the middle of your wrist. So again, 1, 2, 3. I'm going to put my thumb next to there. And if I push down between those tendons and flex my wrist up, it is quite tender. It's very, very uncomfortable. So I'm going to put a mark right there. And it's going to shift a little bit when I turn my hand, but that's about where your point's going to be. All right, so this point's called pericardium 6. If you take your Dolphin Neurostim, put it between the tendons and pull it down, you'll find you get a nice high pitch when you get over that point, and the light goes out. Don't forget that sometimes you have to adjust the wet and dry settings on your device depending on your skin or your patient's skin, because sometimes if their skin is wet, it's going to be very conductive and everything's going to look like an acupuncture point. But if they if they're older and are in a nursing home, or you live in a dry environment, you need the ohmmeter to be more sensitive to find these acupuncture points. So pericardium 6 is an influential point for the chest. It is good for nausea. I have used it on people who were pregnant, who had morning sickness. Actually, my children's teachers, 2 of my children's teachers were pregnant at the same time. And every day I came in, I would treat these points on their teachers. And when I did that, they had a great morning. On days when my kids were sick and I didn't get to the school to treat them, they had miserable days. So it actually works quite well. I've also used it on patients who were having chemotherapy, who had nausea during chemotherapy. There was an oncologist on the floor above me, and I used to treat some of his patients for him. It works very well on nausea for chemotherapy as well. Works on any type of nausea stuff. It influences the chest, so it influences things like anxiety. All of these points together make up what's known as the golden triangle in acupuncture. So when you are doing your vagus nerve stimulation, and you take one of these pads, these 2x4 pads, when you place it on the wrist, you're actually trying to cover those points, okay? So you're actually going to put it slightly below the crease of your palm of your hand. And in doing so, you're going to stimulate those acupuncture points that calm the system down, in addition to stimulating by the ear where the vagus nerve is. All right. Vagus nerve stimulation is generally a very gentle thing. And I do recommend that you go into it slowly. And I do recommend that you monitor your responses when you do it, because you can make yourself kind of tired. I generally don't do it in the morning because it makes me a little sleepy. I generally try and wait until the evening. If you are using this as an aid to recovering from workouts, I recommend that you leave about 3 or 4 hours between your workout and using the vagus nerve stimulation, if you have any choice in the matter. If you're sick, you can use this anytime. It certainly worked very, very well for me when I had COVID. I was doing vagus nerve stimulation every day, and I didn't do it one day because I thought I was getting better. And on the day I didn't do it, my oxygen saturation had been hanging somewhere around probably about 91 or so. The next day, I was treating myself twice a day. The next day, when I woke up, my oxygen saturation was about 80. And when your oxygen saturation hits 80, that's a trip to the hospital if you can't do something about it. So I started diffusing some colloidal silver and breathing that in. But the most important thing I did was I did vagus nerve stimulation. And in a couple of hours of doing that on and off, I brought my oxygen saturation from 80 back up to about 91. So it did work really, really well. And I do highly, highly recommend this device for any kind of recovery from illnesses. All right, so we are at getting close to 8 o'clock now. So I think what we want to do now, unless, Happy, do we have anything else we need to cover?
I think we covered everything.
We've covered everything? Okay.
Yeah.
So I think what we want to do now is take some time and go through people's questions. So let me get my glasses on here so I can read them and address these questions for people. All right, let's see here. Okay. So Matt asked, can we use any other finger? I guess Matt was talking about pushing the button down on this device, or so it's really, if you're missing your middle finger, obviously you can use your you can use your index finger. It's just much more stable to use this, to use your middle finger. I see some people sometimes trying to turn this over and put a finger on here. Oh, on here. So the problem you run into is that people do things like this, and it's. I'll give you an example. So if I'm going to find acupuncture points, I need a fulcrum to be able to do it. So I need my hand down on something so I can use my fine motor skills to locate the acupuncture points. And if you're holding this really any other way, it's really difficult to have the fine motor control you need to find acupuncture points. If you have, I've seen some people have disabilities with their hands and have a hard time finding things. Because their hands won't turn over. They can't pronate or supinate their hands. And yeah, you can do it that way, but I can just tell you after 20 years of doing this, the bulk of everybody who uses it finds this to be the most comfortable way. Let's see here. Can we ground with any fingers or flesh? Does it have to be the thumb? So,
that was just a reposting of the same question
okay.
to clarify
Okay.
on that. So you can.
Good deal.
Answer. I've got.
You know, what you actually can do if you want, something you can do if you're having problems, it's not really grounding, it's completing the circuit. If it were grounding, you would actually be going to ground. But what you actually can do is you can take and put this little pad right here on the device and then stick another pad on your patient, and then you don't have to have skin-to-skin contact with your patient because you're completing the circuit at that point as soon as you touch down. So that's actually something that comes into some of our scar tissue treatments later that you'll get. Let's see else what we've got here. If you're suffering from long COVID, but affected your stomach, is a vagus nerve stimulation enough to cover your stomach and GI area? Yeah, it actually does work pretty well for that, because the reason it's affecting your stomach is because your entire vagus nerve is off kilter, and you actually have a hard time having the right bacteria in your GI tract if your vagus nerve is kind of doing backflips. So it definitely works for any kind of digestive kinds of things. Can you treat a scar from a thyroid removal? Absolutely, you can. The only thing I would tell you is kind of stay away from the carotid artery. It's not so much the electricity, it's the pressure on the carotid artery. Sometimes that can cause people to pass out and things like that. So, I guess I need to go over a couple of the contraindications. So contraindications of this device: don't stick it in your eye. Don't stick this any place you wouldn't stick a pencil. So don't go deep into the ear canal. Don't go into your eyes. But we can use it to treat inside people's mouths, for scars inside people's mouths. There is with some of the devices, if you got a double kit, there is actually one of these extension probes. And you can stick that on the end of the unit. It's made for self-treatment, so it's bendable like this. So you can reach back and treat points on yourself, but we do actually use these for going in. We make the patients buy these, and we use these for going in and treating scars in people's mouths. And when I worked in women's health, we use these for episiotomy scars as well. The patient would buy their own pens and bring them to treatment every day. The other thing you guys can do that you might find helpful when it comes to making a connection with the patient, these are available to order from Acumed. From the Center for Pain and Stress Research. You put this wrist strap on you, You put the other one on your patient. You can put it on their wrist. You can put it on their ankle. And it also electrically connects you so that you don't have to worry so much about touching the metal plates on here. All right. Let's see what we got here. Yes, you can treat scar from thyroid removal. I tried all the protocols in the card. The latest protocol mentioned above the belly button. Not had any improvement with my sleep patterns. What should I try next? Should I increase the intensity? So yeah, we are playing around a little bit with going 4 fingers above the belly button. So you go 4 fingers above the belly button or 4 fingers below the xiphoid process. I would increase both the intensity and the time. In terms of sleep, I'm not sure how you are tracking your sleep patterns, but there are some pretty good actually devices now you can hook up to your phone or your some electrodes you can hook up with that'll give you information on that. But I would also try doing the parasympathetic calming points below before you go to bed. If you have a meningioma, let's see what we got here. On your head, can you use a dolphin? Can you use it for headaches? Yes, you can use it for meningioma, and you can definitely use it for headaches. So vagus nerve stimulation works really, really well for migraine headaches. Typically, if you put the vagus nerve stimulation on, you have a migraine, it's typically gone in 10, 15, max 20 minutes. But there is an acupuncture point on the pinky finger, and it is on the finger side of it. So I guess the thumb side of there. So you come to the, I'm going to draw this for you guys so you can see it. So this is a finger. This is a fingernail. So if you draw a line across the bottom of the fingernail and a line down the side where those lines intersect are acupuncture points known as Jing, Jingwell, or Ting points. So on the pinky finger, if you go to the inside corner and you hop over the ridge, there is a very tender point right there. It's called Heart 9. Heart 9 is an acupuncture point that is for vascular emergencies. Write down H9 if you want to put that in your notes. Typically is reserved for things like strokes and heart attacks. I have used it to restore speech and vision in people who have had strokes, so it works quite well for stroke stuff. But migraine headaches are also a vascular thing. So if you treat Heart 9 on both sides, it's going to be painful. You're going to use the negative setting because it's going to bring things down. If you use that negative setting, that also does a really good job of treating migraine headaches. The other point you might add in there, if you want to write this down, if you have migraines or any kind of headaches, is down on the foot, there's a point called GB41, which is gallbladder 41. That works well for headache stuff. It's for gallbladder 41 is a wind point in acupuncture. So anything that's sudden onset, it works for. And most headaches are generally sudden onset. With the ear stimulation, can the electricity typically be felt, or does it feel like nothing is happening? What I find is if I have a really good connection and I have my Dolphin on the most intense setting, I definitely feel kind of a pulsing in my ear, and I don't like that. So I typically turn mine down until it becomes subsensory. So should you sit or recline when you do a vagus nerve treatment? Probably the first time you do it, I would. But a lot of times I just put the vagus nerve stimulation on, and I raised 2 kids by myself, so I'm always washing dishes or doing something around the house, and it seems to work pretty well for that. What level of intensity for scar tissue? Scar tissue is a matter of passing electrons back and forth through the scar. So the more electrons you can push through that scar, the better the outcome is going to be with your patient. So I try to turn them up as much as I can. That being said, you don't want your patient to have too much stimulation. If you're treating yourself, whatever you can tolerate. If you're treating your patient, whatever they can tolerate, and still come back and see you for another treatment. How do I tell which point I'm on? If I find a point that's very close. So there are some
example.
Yeah, well, there's some acupuncture points that are certainly close together. And that's really a matter of just studying the points and learning. Things that are helpful, you can get things like these acupuncture dolls. They're kind of pricey. You're going to spend like 45 or 50 bucks on one of these things. But it has most of the major acupuncture points marked on it. So you can pretty well see where everything is. Half of the body is done in Chinese, which isn't going to help you out much. The other half is done in English. These are available on Amazon, and they're more expensive than they should be, but is what you're going to pay. And these are done pretty well. You can also, there are actually a lot of apps that you can buy. And actually, there are a lot of free apps too that you can go on, and it'll tell you everything you want. It'll tell you things about acupuncture points that don't even mean anything to you in terms of Oriental medicine. So if you have a question about points, you can actually get one of those apps and just look on there and see what you're close to. Let's see what else we got here. Can you use a dolphin if you have buttocks pain? Absolutely. There's pretty well nowhere in your body you can't treat with these. You can definitely use them on piriformis or gluteus medius minimus. You want to make sure you treat the nerve roots that feed that area, because sometimes it tends to be radiculopathic. Can you cover the right ear with positive stimulation for heart failure? I'm not, are we talking about like acute heart failure?
I believe in the COVID book, or one of the books, it talks about using the vagal stim kit, but using it on the right ear and using it on positive frequency.
Yeah,
That's kind of all it says about it.
So the idea behind that is that what you're doing is you're bringing up the stimulation a little bit so people aren't so sedated. So if it makes you feel tired, you can use it to kind of bring things up a little bit. Can this treat lymph? Absolutely. We have entire courses on how to use this for lymphatics. If you got to think about the things that get in the way of lymph, scars are one of the things that get in the way of lymph moving through your body, and muscle tension gets in the way of moving things through your body. So absolutely. What about bladder control? Definitely. There are specific acupuncture points that address things like both your ability to hold urine in and your ability to get urine out. You want to make sure that you treat all the factors that are affecting it. So that's going to be things like any abdominal scarring, or any scars that cut through any of these acupuncture meridians that have to do with the lower viscera, like the spleen channel and kidney channel and things like that. You also want to make sure you treat the nerve roots that innervate the bladder, because sometimes you have issues there. You also want to make sure you're treating acupuncture points to cover any emotional problems that the patients are having. I got a patient right now who's been having a lot of problems with dripping and stuff like that. But she has a lot of grief issues because her husband got dementia and died, and she's very angry with her husband for abandoning her with his dementia, because they were soulmates, and she has a lot of grief because her husband died. So in addition to doing the acupuncture points that physically affect that area of the body, we're doing a lot of emotional stuff as well, and that seems to be helping us out quite a bit. During treatment, should a person remove Fitbits, smartwatches, O-rings? When you're doing traditional acupuncture, there's a lot of rules, like don't cross your legs and take off all your jewelry, and it's not a bad idea. What I will tell you is this: when you stick needles in people, you're manipulating the body's electrical field, but you're using the body's own electrical field with the needle. When you use one of these, this has a 9-volt battery, so it tends to be a lot more, compared to an acupuncture needle, a lot more like a hammer than a feather. So it tends to push energy pretty hard. So it's not as necessary, but it's not a bad idea. Okay, use 2 sleep apps. You can also look at the time you're having treatment issues. Each in acupuncture, every single meridian has a time when it is most active. And I don't have my little card here with me, but there's a clock you can look at that will give you all the times, which starts at 3 in the morning. So 3 to 5 is lung. Let's see, it ends with liver, which goes from 1 to 3. So if there are specific times you're having sleep issues, you need to look at what's going on with that meridian and treat meridian points with that. Do parasympathetic calming point. Oh, well, sorry, here's one. How many treatments per session do you recommend to a healthy person? Can I do VNS and scar release? More than one scar? How many minutes max for a session on a healthy person? All right, so I would say don't treat your patient for more than about an hour, depending on what's going on. You can spend an hour doing scar treatments on people. I will very often set up my patients with vagus nerve stimulation, and I will do either scar treatments or general microcurrent acupuncture type treatments at the same time I'm doing vagus nerve stimulation. Sometimes I do vagus nerve stimulation and do manual therapy as well. So you can, about an hour. Yes, you can definitely treat more than one scar. I would say with microcurrent by itself, not doing anything else, once you hit about the 40 or 45-minute mark, you kind of saturated your patient. So that's probably about enough for the day. The next question is, do parasympathetic calming points need to be mirrored? So anytime you treat points on one side of the body, always treat them on the other side of the body for several reasons. One is that it provides balance. The other thing is none of us are amazing at finding all those points every single time. And if you try to find them twice, you'll double your chances of treating them once. So you increase the chances you'll have a good treatment. Do treatments deplete minerals of the client and the clinician? No, it does not. But you will find patients who need to sometimes drink electrolytes before you treat them because their skin is not particularly conductive. Is it okay to move around while using vagus treatment, such as getting ready for bed? Yes. Somebody's asking for concussion treatments. Vagus nerve stimulation is part of our concussion treatment protocol. So that's a really good thing to do. I would also tell you that Heart 9, this acupuncture point that is for vascular emergencies, is another good point for post-concussion. You got to remember that anybody who's had a stroke or a concussion is going to have inflammation in your brain that stays there. It doesn't just go away. So unless you do something to have an effect on that, it will hang around and continue to cause problems, much in the way that CTE does. So using vagus nerve stimulation consistently helps bring down that overall level. It drops your patient's cortisol levels, and it actually ends up affecting the overall level of inflammation in their system. There are other things I like to do with patients. I like for my patients to have a diffuser. I like for them to use a decent quality Serrata, which is Indian frankincense, which has high levels of sort of natural anti-inflammatory compounds. So I like them to use that. There are a lot of different things you can do, but vagus nerve stimulation is a really important part of that. We actually do have a hands-on concussion course, and I believe that one is a little bit later on this summer. So get online and check that out. Let's see. How can you tell when the scar is released? It'll actually feel different. Like the first time you treat a scar, most of the times it will look and feel different and will be less painful. Like I said, you get about a 20% reduction in the density of the scar with each treatment. So you're looking at 3 to 5 treatments for it to be completely released, unless it's like a full body burn. What's the recommended treatment for reversing the neurological effects of a medically induced coma? I would say you would want to do vagus nerve stimulation. You would want to treat rescue points. Things to stimulate the system, things like kidney 1 would be a good one. to add into there. Ones that push and move energy, like spleen 6 and stomach 36 together as a circuit, would be good. What about metatarsal pain? Metatarsal pain, make sure you start with the spine and treat the nerve roots that affect the area, and work your way down and look for any trigger points that can refer into the area. And once you've eliminated all of that, you probably want to treat right around the metatarsal with the dolphins, just like you were treating a scar. So you can use this on arthritic joints for temporary relief of pain. Obviously, it's not going to fix it, but it will certainly make it feel better. Do you just use the clips with the left ear? I do mostly left ear stimulation with my patients. Most of my patients need to be brought down more than they need to be brought up. So that's why I use the left ear so much. And most of us do. The right ear is typically reserved for treating people who need to be brought up some. So being research with scar tissue treatment over the spine with hardware, and for those with spinal cord injury showing by treating scar improved sensation or neurological return. Well, as luck would have it, I spent about 15 years of my career working in neurology and neurosurgery offices, and I've treated over tons of scars that have all kind of hardware. And we don't have a specific study on that, but I can tell you that having done it day after day for 15 years, it definitely can help out with that. And the things you hear about what you get after a year is what you're going to get. That's not true at all. I've seen people years afterwards actually make improvements. You can find, where can I find 1020, which is this EEG pace? You can buy it online. They actually have it on Amazon. I experienced a sudden loss of my athletic ability. What would I recommend? I started with VNS, and that's helped some, but the heart still feels intolerant to exercise. I would get that checked out if I were you. If you have either had COVID or had the vaccine or had both, I would just make sure that nothing is going on there that needs further attention. That being said, I know a lot of, and I am not in a position to give you recommendations on supplements or nutritional stuff, but I know that they talk about high dose thiamine and things like high dose magnesium, but that's something you have to clear through a doctor. You spoke about deep abdominal scars. How about for heart ablation? I would treat around the heart. And actually a lot of people have questions about these and pacemakers. So I'm not a doctor, I'm not a nurse practitioner. So when I treat someone who has either a pacemaker or defibrillator, I typically get the doctor's okay on it first. So I send the doctor a message and ask them if I can treat their patient. And if that's okay, they typically always say yes. Although I can be a little hesitant sometimes in treating patients who have defibrillators just because I don't want to set the defibrillator off. Deep abdominal scars, heart ablation. Okay, yeah, you can treat around the scar, not a problem. How do you decrease cortisol in the evening? Vagus nerve stimulation. Had an echo, it was fine, no COVID jab. I would say probably what you want to do is get in touch with a good integrative medicine practitioner, and you're typically going to have to pay for that out of pocket, but that's not a bad thing to do because there may be something else going on. You may be being exposed to mold, or there's all kind of factors that I'm not really in a position to know whether or not are affecting you. Brain fog. VNS, vagus nerve stimulation, works amazingly well for brain fog. I can tell you that in my own experience. What I sent a link for the best acupressure point poster. Off the top of my head, I can't think of the best acupressure point poster. Any of them you find that are fairly large are going to be fine. What's treatment square? The treatment square for abdominal adhesions. Maybe treatment protocol. You're just going to treat it like any other scar. But what I typically like to do with an abdominal scar is to go with the scar. I like to take electrodes and put them on the back and run them to the pads of the unit. And then as I treat the scar, it pulls electrons all the way through the deep abdominal adhesions. I mentioned free acupuncture point apps. Yes, there are a few free acupuncture point apps available. Okay, so somebody missed a little bit of this. If the person's wearing metal, such as jewelry and glasses, will this affect treatment? Should they remove all metal? Not such a big deal with the metal. You can if you want to, but it's certainly not going to kill the treatment. All right. We still got about 9 minutes left. So does anybody have any other questions? Let's see what we got here.
If I purchased one Dolphin unit and need to purchase the other, how should I get that at the bundled price? It'll be within a week, the purchase.
I would just call them and say, hey, look, I got one unit and I like it a lot and I really want another one, and I paid full price for one. Can you go ahead and extend the bundle price to me?
Great.
And ask nicely. Don't say Joe said you would do this, but just
Okay.
ask nicely. They're usually very nice about that kind of thing.
Okay, thank you so much.
You're very welcome. Do I have a protocol for a child with ADHD? So with ADHD, my son has some attention. He's ADD, not ADHD. So I typically do vagus nerve stimulation on him twice a week. I treat parasympathetic calming points on him. And you can certainly do things like a cranial release, like we would do for a concussion. That seems to work pretty well. But the parasympathetic calming points work really well. I have parents who use those on their children before they go to school, and they have definitely noticed that, and reports from the teacher, that the kids are performing better in school when they're doing vagus nerve stimulation and parasympathetic calming points. Will there be a transcript for this Zoom? Typically, they put these up on YouTube so you can find them. Can VNS be used throughout pregnancy? I would get the okay of your OBGYN. I used to spend 1 day a week for, I don't know, about 10 years. I used to go to a women's health clinic. And I treated a lot of pregnant women for things like sciatica and all kinds of other weird things, ones whose blood pressure was dropping down too low. And the doctors actually recommended the microcurrent stuff for the patient, but I would always get their okay. You want to make sure it's not some kind of weird, some type of weird presentation that they don't want you to do that. How young can you treat kids? I treated my children when they were infants. I mean, babies. Works great for colic. We actually did a workshop one time down at All Children's Hospital in Tampa, and we taught them to use this device for spasmodic torticollis in babies, so their heads don't get misshapen. So you can actually start really young. The advice I would give you is to use the unit on a low setting, and don't use it for as long. How frequently can you do VNS? I do vagus nerve stimulation about twice a week, but if you have an acute presentation, you can certainly use it every day and sometimes a couple of times a day. I bought the shoulder DVD. Is that the equivalent to taking the course? In terms of, I'm not sure if that is in terms of getting CEUs or what. I'm of the opinion that hands-on courses are always going to be a little better than doing things online. There really is something important about being there with an instructor and especially with this kind of equipment, showing you how to hold it and having somebody watch you actually do the treatment. It's a really, really useful thing. That being said, the online shoulder course is pretty good, but you'll pick up some extra stuff if you do it in person. Okay, let's see what other questions we have here. Oh, no. Oh, here we go. Oh, that's a. Okay. Let's see. How do you treat a Baker cyst behind the knee? Well, you're going to treat the low back and hit all the nerve roots that go into that area because there's a lot of extra pull going on in that area. So you have to decrease the muscle tone. You're going to treat all around the kneecap, and then you're going to get behind the knee and treat. And those are really tender acupuncture points on the crease of the knee. So just be aware it's going to be uncomfortable. If we treat a client for 8 hours a day, will this have a negative effect on us as clinicians? Will it overstimulate our bodies? No, I've been doing this for about 20 years, and a lot of others of us have. What it does seem to do is it just kind of moves the electrons, kind of keeps the flow of electrons going through your body. So there's something called grounding or earthing, where you actually go outside and put your feet on the grass, or you connect a ground to the plug in the wall. And part of it is to disperse excessive electrons, and actually using this device actually helps you do that. Does microcurrent help with heel spurs, decreasing the size or helping to dissolve heel spurs? It does not dissolve heel spurs. It will, if you use our treatment for that we typically do for plantar fasciitis, it will relax the overall tension on the muscles that run down to there and take some of the pressure off. But you're gonna, if the heel spurs are small enough, you can use some manual pressure on them, but otherwise it's not going to get rid of them. Can I show points to treat for metatarsal pain? I do not have that chart sitting in front of me right now. And I apologize. I would have to go to my house and grab all those books. I'm at the office at the moment. Will you get another manual? Let's see. That's Deb. Deb, what kind of manual are you looking for? Like for the course? Thanks for coming, Matt. You don't get a manual for the for doing the tutorial, but you do get manuals for every single course you take, whether it's an online course, like an actual like CE credit online course. They'll give you one you can download, or our in-person courses, you get manuals there. All right, guys. Well, it looks like we're at about 8:30. Anybody have any other questions before we get out of here? All right, guys. Well, thank you so much for coming out. I really appreciate you taking your time to come out and hang out with us. If we have any, we have these usually about once a week. So if you could get back on again and have any questions, you are certainly welcome to join us.
Well, what's the YouTube? What's the YouTube channel that these are posted on?
It's not on a particular channel that I know of. I just know that my kids found it the other day and showed it to me.
Yeah, I can help you with that. I'll send you the YouTube link where we have all those recorded Dolphin tutorials that we did in the past, and you can access from that link.
Oh, there we go. Hetvi is our, she's our guru when it comes to that kind of thing. I'm just kind of a guy who uses this stuff every day. So I'm definitely not the technical guy on this kind of thing. All right, guys. Well, it is 8:30. I've got to run home and get my children ready for bed. So thank you so much for coming out, and look for a recording somewhere on YouTube. So we'll see you guys next time. Okay. Good night.